Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Class 7 of variations, Mullarian anomalies. Class 7. In class 7, class 7 includes the congenital problems due to the exposure of diethylstilbestrol. The diethylstilbestrol in females and males. In females, the uterus in females is hypoplastic uterus most commonly, and the uterus is T-shaped uterus. T-shaped uterus is the most characteristic here. In females, there can be presence of cervical collars or hoods are seen. There are two cancers which can be associated with diethylstilbestrol exposure in females, which includes clear cell, first adenocarcinoma of cervix, second clear cell carcinoma, and third that is a clear cell carcinoma of the vagina. So there are two cancers associated, which is adenocarcinoma of cervix and the clear cell carcinoma of the vagina. Then, in the vagina, it can also result in vaginal adenosis. There are no renal anomalies in the female child in diethylstilbestrol exposure. In the males, we can see hyposporidiosis, cryptorchidism, testicular hypoplasia, and this can also result in renal anomalies.
thank you and thank you for watching.